Good evening, welcome, and thank you for joining tonight's webinar on Apprenticeship Benefit Awareness. Also, I want to congratulate the new apprentices on acceptance into the program and the best of luck to you over the next 4 years. My name is Joe Obhowitz, and I'm the Fund Director here at the Carpenters Benefit Funds of Philadelphia. As union carpenters, floor layer, dock building, cabinet maker, or millwright apprentice, you have one of the best fringe benefit packages in the industry. Understanding your benefits and entitlements now and throughout your career is important, not only for you, but for your family. Tonight, you will learn about the important resources available through the fund, the collection of your work hours and fringe benefits, the vacation and dependent care accounts, an overview of your health benefits, including how to qualify for healthcare coverage, the healthcare providers that we use, your health reimbursement account, also known as the HRA, preventative health information, and then we'll give you a summary of your retirement accounts, specifically your pension account, the annuity account, and the savings plan. Joining me on the panel tonight is Dave Latuchko. Dave is our collections department manager, and we'll give a presentation on the collection of contributions, and Mike Wagner. Mike is our medical department manager, and we'll give a presentation on our health and welfare benefits. Some quick housekeeping item to go over is everyone will receive a digital copy of tonight's seminar, so look for that in your email. Also, everyone that is attending will automatically be entered into a prize drawing, and we will pick 4 winners that will receive a $25 Wawa gift card. The gift card will be mailed to all the winners. Before we get started, if you have any questions during the presentation, look for the control panel and type them into the question box. The slide is showing examples of where you can find the control panel box. If you're using a home or laptop computer, it should be located in the top right-hand corner. If you're using a mobile device, it should be located at the bottom. The fund staff will be monitoring the questions during the presentation, and we will answer any and all questions at the end. Now, who is the Carpenters Benefit Funds of Philadelphia, and what do we do? I think it's important for you to understand, and if you can follow along on the slide, that we, as I mentioned, are the Carpenters Benefit Funds of Philadelphia. We are a separate entity from the union itself. We are located downtown Philadelphia at 1811 Spring Garden Street, right next to the union headquarters. But the difference between our offices, we are governed by a board of trustees. And those board of trustees are made up of 6 labor trustees, made up of the union leadership, and 6 management trustees that are made up of the ownerships of the companies and the respective associations. The 12 trustees put together what's called the Plan of Benefits. And currently we have 3 plans of benefits. We have the Health and Welfare Fund, the Pension and Annuity Fund, and the Savings Plan. We, as the fund office, it's our responsibility to manage the day-to-day operations and enforce those rules under the plan of benefits that are set up by the trustees of those respective plans. The fund office has 3 major departments. We have our Health and Welfare Department, we have our Retirement Department, and we have our Collections Department. Let's look at the roadmap on how the flow of wages and fringe benefits work and how the fund office fits into the union umbrella. On the slide, you have Joe wages. Joe receives a paycheck each week from his employer. Joe's employer will then send the fund office his fringe benefit package for all the hours that he worked. The employer typically pays the fringe benefit package on a monthly basis. The fringe benefit package, also known as contributions, includes the health and welfare contribution, the pension, annuity, and savings contribution, the vacation and health reimbursement account contributions. The fund office's responsibility is to handle those respective accounts for you throughout your career. Just important resources that I'd like to touch upon. If you haven't done so already, make sure you check out the fund's website at carpenters.fund and download the app for benefit information, explainer videos, and important announcements. Also, make sure you use the new chat feature to connect with staff members during normal business hours. We pride ourselves in our communications and participant outreach. Another way for us to help communicate benefits is our Carpenters.Fund newsletter. It's a monthly newsletter that will be emailed directly to you to the email record we have at the fund office. We want to make sure that you're reading that so that you can stay connected and up to date on the latest fund news, announcements, and benefit reminders. Also, if you're on social media, please follow us on Facebook, Instagram, and Vimeo. With that, I'll turn it over to Dave Latuchko, our Collections Department Manager. Take it away, Dave.
Thank you, Joe, and good evening, everyone. I just wanted to take a moment to thank you all for taking some time out of your schedules and spending it here on this webinar. I do believe that this is a very worthwhile investment of your time. Knowing your benefits, especially this early on in your career, will be beneficial to you and your families for years and years to come. As has already been mentioned, my name is David Latushko. I manage the collections department, and we're just going to get into a little bit of what we do here in collections. So first and foremost, we make sure that your benefits are paid in on time and in full from union employers. Once that money comes in, we allocate it to the proper funds. That it goes pension goes to pension, health and welfare goes to health and welfare, annuity, savings plans, so forth and so on. We also administer the cafeteria and the vacation benefit and out-of-area work, reciprocal hours. You may have heard that term. We help make sure that the proper funds go to the proper areas, and we'll get into all of that a little bit later. So if there's one thing that I want you to remember from my portion of the presentation, or maybe the presentation overall, it's to check your hours. Check your hours, check your hours. Please check your hours. The presentation isn't stuck on repeat. I did repeat that because it's so important. If your hours don't come in, you don't have healthcare eligibility to look forward to. If your hours don't come in, you don't have a pension to look forward to. The amount in your savings plan or the amount in your annuity is less. It's like money literally being taken out of your pocket. So please check your hours. The first and foremost, the best tool that you can use to check that is carpenters.fund. Go on the website, carpenters.fund. It's so easy to remember. And you'll log in and you'll see your member dashboard. You see that button right there, access your dashboard. This is what that dashboard looks like when you log in. We'll go through what every part is. On the left-hand side, you see all your personal information, who you are, and down bottom, an important feature for apprentices, you see your apprentice level, what year you're in. I know you guys call the benefit fund and you ask for those hours totals. That's great. Feel free to do that, but that information is available to you anytime, any place at carpenters.fund. It also tells you whether you're eligible for healthcare benefits. On the right-hand side, on the top, you see your grid. You see the employer that you work for, the period end date, the hours, and the wages. Again, compare that to your pay stub, and if something doesn't check out, please let us know. And down below that, your annuity information, you'll actually see how much money you have in your annuity accounts and whether you are vested in the pension and annuity plan. Again, a super, super good resource for you. Please check it out. We also mail work record reports 4 times a year. You'll see that work record report on the right-hand side. It gets into a little bit more information, how much money actually went into those accounts. And you see when those go out 4 times a year, May, August, November, and February. Please take a moment and also review those when they come out. If you work out of area, our council, the Eastern Atlantic States Regional Council of Carpenters, is very large geographically, but the benefits don't all go into one place. There are many benefit fund offices that make up that geographic jurisdiction. If you work in New Jersey, that's considered out of area as far as benefits are concerned. You'll have to fill out a reciprocal form. If you work in Empire State, the state of New York, or in New York City, those are also 2 different areas. Please go on carpenters.fund, fill that out so that your money can come home and live with the rest of your money. That's where it will serve you best. If you have a question, you don't know whether an area is considered quote unquote out of area, call us. We'll be happy to explain that to you. The vacation plan, just a quick note here, those funds are not reciprocated. You will have to contact the specific benefit fund office and retrieve those funds directly. Also, a quick note, once you fill out a form for New Jersey, you don't ever have to fill out another one again. That's good for your lifetime as a carpenter. Once you fill one out for DC or New York City or New York State, again, that's good for your lifetime as a carpenter. If you check your hours and you notice that you're missing hours, you worked 40 hours some week, but your employer paid in 32 hours, you need to make sure that that money is paid. You can report that to us, request a review hours discrepancies form right on carpenters.fund, or you can call us, you can email us, get that information to us, and we'll be happy to make sure that that's collected. As a rule of thumb, the longer you wait, the rule of collections, the longer you wait, the more difficult it is to collect those benefits. So if you're a month or two out or 6 months out, very, very good chance that we'll get that. A couple years, still a pretty good chance, but it gets a little more difficult. 20 years down the line, it might be very tough. So don't wait too long. Make this a good habit, whether it's once a month, once every 3 months, at least once a year. Check your hours. Make sure that everything that you worked has been paid on your behalf. The vacation and dependent care benefit, sometimes also called the cafeteria plan, that's all the same fund. There's just a couple different ways that it can get paid out. There are two ways that this fund gets paid out. The first is it gets taxed and paid out as a vacation benefit. This means you don't make any type of special elections. You basically do nothing, and this happens automatically. It happens 4 times a year: February, May, August, and November. Again, it just goes automatically as a taxed benefit into the account of your choosing. It's all direct deposit. If you have small children under the age of 13 that you pay child care services for, you can choose to have this benefit, the vacation benefit, paid out as a dependent care reimbursement. That election must be made the December prior to the year. All payments go direct deposit. There's no paper checks that go out of this office for dependent care or for vacation benefit or for the HRA benefit. You can update your direct deposit information right on carpenters.fund. Make sure you do that so that your money is going to the right place. You might be saying, well, I've been in the union for a year or 2 years. You said this happens automatically, but I haven't seen my vacation benefits not being direct deposited. Very good chance that it's in the Union Building Trades Federal Credit Union. You see their website and their number right there on the right hand side. Please reach out to them. You may have some deposits that were made on your behalf there, at which point you'll be able to either open an account with them if you want to, or if you just want to retrieve your money, you'll verify your identity with them and they'll mail you that paper check. So a quick example of how the vacation and dependent care benefit works. Now, on the left hand side you see our mascot, Joe Wages. He works 160 hours for each of the summer months, June, July, and August. That's 480 hours at 75 cents per hour. Usually most standard rates are 75 cents an hour for the vacation benefit. That's $360. If in December 2019 Joe Wages elected to have that money paid out as a dependent care reimbursement, and he provided the form along with the receipts, that money is tax-free and gets direct deposited tax-free into his account. If Joe Wages doesn't have small children or failed to make an election the December prior to, or just did nothing, just forgot about it, that money gets taxed and it gets direct deposited directly into the account of your choosing. If you didn't choose one, again, that goes to the Union Building Trades Federal Credit Union. Some other things that we do here in the collections department: any demographic information or kind of contact information we help change in the system. So if you need to update something, you move, you can contact us regarding that, or just visit carpenters.fund. We also perform employer audits. We have a team of auditors that go out and perform payroll audits. They review payroll that you worked and make sure that all the benefits are paid. So another checkpoint. We also handle direct deposit. We got into that, and we'll end where we began. Please check your hours to make sure that you're getting every hour of benefit that you worked so hard for, and that it's in the right place, and that it's helping make your and your family's lives better. Thank you. And with that, I'll pass it off to Mike Wagner, Medical Manager.
Thank you, Dave. Good evening, everyone. My name is Mike Wagner. I manage the medical department here at the Philadelphia Fund Office. The roles and responsibilities of the medical department: we track and update your eligibility for our medical benefits. We process, pay, and audit claims for both our in-house benefits and our vendors. We maintain and recruit providers for the benefit fund's in-house network. And most importantly, we assist you, the participant, in regards to questions you might have about your medical benefits. The first thing we're going to get into tonight is the eligibility requirements for our health and welfare coverage. If you're not currently eligible, if you've never been eligible for the Carpenters Benefit Funds, you're in what you would call your initial eligibility phase. And what that is, it's when you work your first 600 hours in a 6-month time frame. That's unique to you. So once you work that 600 hour for the first time, the example, if your 600th hour comes in the month of January, typically paid in the month after in February, your eligibility would begin on March 1st. That process happens automatically. We track that here at the Medical Fund Office. And as Dave said, this is why it's so crucial that you check your hours. Know where you stand in regard to getting your initial eligibility. Once you're eligible, you live and die by the same rules as a journeyman carpenter. There's 2 benefit periods every year. Our first one is May 1st. The second one coming up in just a couple days is November 1st. Each benefit period has a corresponding work period. For May 1st, it's August 1st to January 31st. You need 600 hours there. We understand, the board understands that there's ebbs and flows in the carpentry industry. You might be very busy in the summer. You might be off for a couple weeks if it snows in the wintertime. For that reason, we not only look for 600 in the 6 months, we do a 12-month look back for each benefit period if you have 1,200 hours there. So for the May 1st, February 1st of every year to January 31st. For November 1st, the 6-month time frame, February 1st to July 31st. Again, double that, 1,200 hours from August 1st to July 31st. And again, I'm going to harp on the point Dave made. Check your hours. Know where you're at and reference that 600-hour mark. We're about halfway through the work period for next May's benefit period. You want to know always where you're at and where you stand in regards to that. Now, once you're eligible, initial eligibility, or once you start continuing your eligibility, you're going to get an eligibility packet from the fund office. It contains 2 forms that you want to make sure you're aware of. It's our annual enrollment and coordination of benefits form, also known as a COB. You may have heard guys on the job site refer to it as that form that puts my check on hold. It's very important to the fund that we get this back for a couple of reasons. It lets us track your census, make sure we have the up-to-date information. It's how we coordinate benefits if you have another coverage. If your spouse is working and covered under an employer, or if you guys are still young enough to be covered under your parents' insurance, it tells the fund office what order we pay in and make sure that we have your right dependents and census. It goes out every year in March. It's due back to us by April 1st. You have to fill it out no matter what, even if there's no change. Once a year, this comes back to us. Make sure you're filling it out. You can do it in a couple of minutes. It's very easy online. Log into carpenters.fund, make sure your information's good, update anything you need to, and get it done. The most important reason for you as a participant, again, it's that form that puts your check on hold. We will hold your vacation payment. Dave mentioned the quarterly payments. They will not go out in May if this does not come back to us. So make sure you pay attention, make sure you're filling that out. The second form is the Census and Beneficiary Designation Form, Beneficiary Card. Joe is going to get into your pension entitlements, what you're working so hard for. There are going to be some very wealthy accounts. If in the event you pass away before claiming those, you want to make sure you have a named beneficiary that the fund can make payment to. Get in the habit once a year of logging into carpenters.fund, view who your beneficiary is, make sure one's on file, make sure it's the right person. If you're young, you name your ex-girlfriend your beneficiary right now. Don't let that be your beneficiary when you're 50 years old. Like I said, get in the habit once a year of logging in, make sure it's the right person, make sure it's up to date. Outside of our eligibility packet, you're going to get a couple things in the mail. You may already have gotten your HRA card if you're eligible for that. It comes in separate envelopes from that of the fund and in 3 separate envelopes. It's your medical insurance from Independence, your prescription card, and like I said, you may have already gotten this blue HRA MasterCard if you're working in a jurisdiction that's got the HRA. I'll get into that in a little bit. The benefits that you're working toward, so once you hit that eligibility, what you're entitled to, it's broken into 4 major categories. Major medical through independence administrators, our behavioral health benefit for MHC, our prescriptions through Express Scripts, and our in-house benefits handled here at the fund office. For both our medical and our behavioral health through independence and MHC, it's what's called a 90-10 coinsurance plan. What that means is that the fund is going to pay 90% of an allowable rate. You as the participant are going to pay a 10% coinsurance. There's a couple of terms that we want to make sure that you're familiar with as a participant. The first one is, what is coinsurance? You may be familiar with a copay if you're used to having that, again, through your parents' insurance. If you know friends that have a copay style, that's where it's a fixed rate, $5, $10. A coinsurance, like I said, is a percentage of the bill. As a very quick example, if you went to an office visit, the doctor charges $150. We use independence administrators, and what that does, they never pay what the doctor actually charges. It's called the allowable rate. Let's say on 150, they allow 100 for easy math. 90-10, the fund's going to pay $90. Your 10% is going to be $10. The next important term that we want to make sure you're familiar with is, what is an out-of-pocket maximum? So our plan is a 90-10. We always say 10% like it's a small number, but let's say you have a surgery, you have a newborn baby, that 10% can really add up in a hurry. So in that case, we have an out-of-pocket max. It's not to be confused with a deductible. A lot of times we hear that from members. A deductible, similar to your car insurance, is the amount you have to pay before your insurance kicks in. We're not under one of those plans. We pay on first dollar, so once you're charged, we will start paying. The out-of-pocket max is the opposite. It's the most you can pay out before the fund pays in full. So as an example, if we did not have an out-of-pocket max in place, you have a surgery, the doctor charges $75,000. The IA allowable rate, let's say, is 60 grand. In a true 90-10 with no out-of-pocket, the fund would pay 54. You as the participant would be left holding a bill for $6,000. The board is very conscious of you having to pay things out of pocket. So for our plan, we have a $2,000 individual, $4,000 family out of pocket. So same example. You go in for a surgery, they charge $75, IA allows $60,000. In that case, you're not going to pay that $6 grand. You're going to pay your $2,000 and you're going to be considered maxed out. The fund is going to pay the remainder of that bill, so $58 grand. And for the rest of our plan year runs every year from May 1st to April 30th. For the rest of the plan year, the fund is going to pay for you as an individual at 100% for anything that goes through independence administrators or mental health consultants. So that's the example of what you're going to pay if you go for a regular doctor's visit, if you go into the ER or the hospital. But how do you know what to pay as the individual? You're going to get probably a bill from the provider. Additionally, your insurance company is always going to send you what's called an explanation of benefits. In short, it's referred to as an EOB. You want to make sure that anytime you get services, you're getting both the bill and the EOB. It comes in an independence insurance envelope. Open these. Don't let them sit on your table. The reason you want to make sure you're familiar with this, if you look through the columns, it's going to tell you what I owe. That's going to break down that independence allowable rate. It's going to show you what the fund pays as our 90% and what you might owe as your 10%. The reason you want to open these, if for any reason something was denied, as the insurance company, we never go back and double check it in case you forgot to give your card, the doctor typed in the wrong numbers, or it was something that they should have gotten information from Independence for. You want to open this and make sure that they're not going to bill you when we could have paid. So open it. If you get a denial, call Independence administrators and help figure that out. Our prescription plan, I mentioned the 2 cards. You want to make sure you're carrying your Independence card for medical, doctors, hospitals, ER. You want to keep your Express Scripts card on you at all times too. That's what you're going to give to the pharmacy. Better yet, go in, log into the App Store, download both of their apps, and you have digital copies. That way you're carrying your card no matter what. But our prescription plan through Express Scripts, generic medications, $5 copay, $10 copay. If you utilize a Rite Aid pharmacy, we're going to waive those. So in that case, it's free to you. Your brand medications are split into 2 different types. There's a preferred brand and a non-preferred. If you can't get a generic from your doctor, they prescribe the brand for one reason or another. Preferred means that Express Scripts has it on their formulary. They usually will pit 2 brand names against each other. Preferred, you're going to pay 25%, but we max your out-of-pocket at $75 for 30 days, double that for a 90-day supply, $150. If it's a non-preferred brand, it's the brand that Express Scripts doesn't like you to take, it's going to be 40% of the total cost, and there is no max. So what I want you to take away tonight, number one, carry your Express Scripts card and make sure your pharmacy has it. Number two, if ever you have to pay more than $5 or $10 for a generic, or better yet, free at Rite Aid, or $75 or $150 for a preferred brand, call the fund office before you pay that. We can typically intervene, make sure if there's any reason it was denied, if they didn't run the card, we can get involved and make sure you're only paying this. We would hate to see you pay $500 in cash for a drug as something as simple as they didn't have the right card on file. So again, call the fund office, make sure you're not paying too much money. That's our vendors, IA, MHC, and our prescription benefit through Express Scripts. There's also what we refer to as your in-house benefits, and what we mean by that, it's the benefits we administer at the fund office. It's your dental and orthodontia, or your braces, it's your vision benefit, your ambulance benefit, and durable medical equipment, usually referred to as DME. That's knee braces, elbow braces, walking boots, if ever you encounter that. There's a couple of benefits that really, if you take anything away tonight, you want to make sure you're paying attention to. It's our $0 copays. So the $10 you'd have to pay through IA, we're going to waive that in these instances. It's MD Live, that's a telehealth vendor. Download the app tonight. It's live as of November 1st. You want to make sure you have the app on your phone, that you take advantage of MD Live. Progress Physical Therapy, being in the construction industry, it's inevitable that at some point in time, something's going to hurt. Shoulder, knee, hip. Because of that, Progress came to the fund office and said, look, we can take care of your people and not charge them anything out of pocket. So in that case, if you utilize Progress or one of their affiliates, you can find their numbers on carpenters.fund. You don't have to pay anything if ever you need physical therapy. Same for HCSC, Healthcare Solutions, know their number. If you need an X-ray, a CT scan, we're going to pay for that in full. For blood work, you want to use LabCorp. This one is not an option. You can't use LabCorp or Quest. We only use LabCorp. So if ever you go to the doctor and they ask, make sure you know that. We have a deal with Temple Health for certain scans that we pay for. And again, our Rite Aid prescription so that you save money on those generic drugs. If you do have to pay the 10% out of pocket, you have something in place depending on the rate you're working at, called your health reimbursement account, or your HRA. It's that blue MasterCard. What that does, it's a tax-free benefit that helps cover your out-of-pocket medical expenses. It rolls over year to year. You might have friends or family that have an FSA or an HSA. Those are use it or lose it. They're typically loading up on allergy medicine at the end of the year to make sure that they don't give up that money. Ours is not the same. Your balance rolls if you don't touch it. You just continue to build that like a health savings account. Two ways to access it. I already mentioned the blue MasterCard that you might have gotten. There's also the web portal or the mobile app that you can log into and submit the receipts there. The login information is available to you when you hit that portal for the first time. The important thing to note, it's different than the login you're going to use for your member dashboard. So when you get in there, make sure you know how that's structured. Download the app, make sure that you use your fingerprint or your face or whatever you do so you have access to that to upload those receipts. There's two ways to access it, the card or the portal. They do work for different benefits. We want you to understand how that goes. Both will work for your regular routine things, your doctor's visits, hospitals, prescriptions. There are certain things we don't allow the MasterCard to work for, and those are mostly your in-house benefits, dental treatment, your vision care, if you take an ambulance ride. The reason that we don't want the card to work is because we don't want you to go to the dentist and the dentist just take your card and run $1,000 against it. We want them to submit a claim to the fund office. If the fund can pay the bill, we would prefer to rather than you hit your HRA. The HRA, like I said, it doesn't expire year to year. It will continue to roll over for you. You can use it to save if you have a baby and you have to pay that $2,000. If when you get older, you're in your 40s and 50s and start taking routine meds, you want to make sure that's available to you. Or if you're really lucky, you carry that balance all the way into retirement, you can start paying your co-pays 30 years down the road. Things that the HRA is never going to be eligible for, and I know it's funny, but we do get this question a lot. You can't buy groceries, can't fill the tank with it. It definitely will not give you cash at the ATM. We've had guys try. It will not go through. As a very quick example, the two different ways you can access it. The MasterCard is not like a Visa prepaid card. We're not putting money back on it when we reimburse you. It's just one way to access the money that's in your account. So as an example, if you have to pay the $10 prescription copay, you didn't go to Rite Aid, let's say your balance is $500. You swipe the HRA card at the point of sale at the pharmacy, it's going to withdraw that $10 automatically. Now your balance is $490. Same example, let's say you happen to not have the card on you at the time, you get to the pharmacy, you pay the $10 copay in cash. Your HRA has $500 in it. You're going to take the picture of the receipt and the pharmacy bag for $10, upload it through the portal or the app. It's going to bring your HRA balance down to $490, but then we're going to deposit the $10 into whatever bank account we have on file. So like I said, just two easy ways to access the money that's in that, just two different ways to do it, whether you swipe the card or you're paying out of pocket and you're submitting to us for reimbursement. That's the benefits that you're working for. What I want to highlight here, and I know you guys are young, you probably feel invincible. No matter what, we can't fight it. We get older, we get sicker. You need to take care of yourself. You're out there working hard as a construction worker. You don't want to work so hard for what we consider the best benefits in the industry to not utilize them the way you should. So we want to highlight your preventative health, the things you want to make sure you're taking advantage of to stay invincible. You're young, you're not getting sick. Use what you need to now to stay healthy. That way you don't end up having to pay out of pocket for chronic illnesses when you get older. These are all paid at 100%. We want to make sure that you're aware of them. It's your comprehensive annual physical. At the very least, find yourself a primary care physician. Go for your wellness check once a year. Understand how you're doing. Joe always uses the quote that we take better care of our cars than we do of ourselves. We get our cars inspected. We take it to the mechanic for tune-ups. Treat yourself the same way. Find a primary care physician. Make sure you're going for that annual wellness visit. Use your vision benefit for your annual eye exam. Get your dental checkups, again, paid in payment in full if you're using the fund's participating providers. You can find those on carpenters.fund. We do offer nutritional counseling. As an American, it's something that we all deal with. We have terrible diets. A nutritionist can help realign that for you. You get 6 of those visits every year. And then, of course, your vaccinations. It's flu shot season right now. Probably getting bombarded when you go to the pharmacy. Get your flu shot, it's covered at 100%. Get your vaccinations. When you talk to your doctor at that wellness visit, they're going to tell you based on your age or gender what you're eligible for. Make sure you're going through with that. If you have questions about our benefits, and we all do, we have a lot of benefits, thankfully. A lot of things you can take advantage of, a lot of questions you may have on where the best place to go is, what the best time to do things. For that reason, the fund has coupled with Temple Health and brought 2 nurses on our team. One that sits in our office 5 days a week. She's making outbound calls if you end up in the hospital for any reason. We also have a mobile nurse. If you're really in bad shape, she might pop into the hospital and visit you. She'll make sure that you know your entitlements. She'll know if you need Progress Physical Therapy, how to contact them and get set up there. If you have any questions, please call into the fund office. Talk to our nurses team. They're here as an advocate for you. They don't report back to the board. They don't report to your employer. Again, they're here to make sure you know your benefits and that they can help you. They don't necessarily, they work for Temple, they're trained by Temple, but they won't steer you to Temple only. If you're from South Jersey and it's better that you go to the Jefferson that took over Kennedy, they're going to send you to Jeff. They're going to send you to the best place for you, for your care. So again, know that they exist. Call them when you're in need. One major benefit that we want to highlight, it's our disability or work comp benefit. I want to make sure that you guys are aware of this. Keep it in the back of your mind just in case you're injured. Our weekly disability benefit, if you're hurt off the job, you're at home shoveling snow and throw your back out, you're putting up Christmas lights and fall off the ladder, or you just need a routine elective surgery like a rotator cuff that didn't happen on the job, your employer isn't required to put you on their work comp benefit. So no one's paying you, and most importantly, no one's paying in your hours that Dave mentioned are so important to both your health care and your pension. In that case, the fund office sort of becomes your employer. So we're going to pay you $550 a week. And most importantly, we're going to put 30 hours a week into your health and welfare fund, keep you eligible for benefits, 30 hours towards your pension fund, which Joe was going to mention keeps you credited toward years. If you're hurt on the job, that's going to be slightly different, because in that case, you're going to be on your employer's work comp. We still have a benefit for you. Work comp is required to pay you weekly, so in that case, it's a much smaller financial gain. It's not $550 a week, it's going to be $100 a week. And it goes on for 15 weeks. It's just to supplement what your work comp's giving you. But they're not required to put in. Since you're not on the job site, they're not going to put in those hours. So in that case, apply to the fund. We're going to put in 30 hours again to your health and welfare, 30 hours to the pension. I can't stress it enough. You need the hours to get the benefits. You might hear guys on the job site, and it's the wrong advice, telling you take unemployment over the fund's disability benefit. Again, the problem is unemployment might pay slightly more, but they're not required to submit hours. And in that case, you're going to lose your health care. You might be in jeopardy of losing your pension years. Don't run the risk. Call the fund, call the fund's nurses if you're injured. Make sure you know about these two benefits and that you're taking advantage of it. That's really a very quick breakdown of our complicated and very rich health benefits. If you have questions that are important to you, if there's anything I went over tonight that you need more clarification on, please log into carpenters.fund, review our benefit entitlement page. We have some very quick videos there that'll elaborate on the 90/10 on how to become eligible. Or if you have any questions, please call into the fund staff. We can answer anything that goes on with your questions. And the one thing I want to mention again is if ever you get a bill that doesn't look right, please be proactive. Call the fund office, make sure that we're aware of it, and we can assist you with that. And with that, I'm going to turn it over to Joe to go over your pension, annuity, and retirement accounts.
Thank you, Mike. Before I summarize the pension, the annuity, and the savings plan, I'm just going to talk about the retirement department. The retirement department, as I mentioned, is one of the key departments within the fund office. Their responsibility is administering the day-to-day operations of the pension, the annuity, and the savings plan, to calculate pension statements, to process any type of retirement appointments when you do come in for future retirees, and more importantly, to ensure that your pension, annuity, and savings accounts are accurate and up to compliance with government statutes. I always think this is important to show the apprentices and know that this is what you're working for. You might not be thinking about it right now, but the time does go quick. And this is what it's all about getting up early to travel, the bad foreman that you may work for, the daily grind, that it is worth it. We want to make sure that you're going to retire with dignity and security for you and your family. Now, these are real numbers of an average carpenter that retires between 25 to 30 years of service. It's not uncommon that they will have an annuity account balance of approximately $300,000, a savings plan account balance of approximately $80,000, and then an average monthly pension somewhere between $5,000 to $6,000. Again, these are not made up numbers. These are average numbers of a guy or a woman carpenter that would typically retire with between 25 to 30 years of service. And I think it's important for you to understand and see those figures and imagine what they're going to look like in 25 or 30 years from now. Okay, now we're going to talk about vesting and credited service. And you're going to hear the word vesting a lot, especially when it comes into play with your retirement accounts, most notably your pension, your annuity, and your savings account. In order to what does the word vesting mean? The word vesting means that you have 100% ownership in those accounts. In order to become vested, you have to have 3 years of credited service. And on the next slide, I'm going to explain to you how you become vested in your retirement accounts. Now, how do you become vested? Well, first of all, as I mentioned, you need 3 years of credited service. Now, how do you attain credited service? Well, if you work less than 200 hours, you don't receive any type of credited service. If you work between 200 and 399 hours, you get a quarter of a year credit. 400 to 599 hours, you get half a year credit. 600 to 799 hours, you get 3/4 of a year credit. And 800 or more hours, you get 1 full year of credit. Now, as an apprentice just starting out or a new member just starting out, you need 1 good year of 800 hours before you can qualify for any of those fractions can be applied. And on the next slide, I'm going to show you a nice, clean, easy look at somebody became vested after 3 years. You should know that the plan year for all of the retirement accounts starts on May 1st and ends every April 30th. So that 12-month time period is considered the plan year. So if we look at this example, the first plan year that the participant started working was May 1st of 2017, and it ended April 30th of 2018. This particular participant worked a total of 1,400 hours. That is more than the 800 needed, so we earned 1 year of credited service. The next year, May 1st of 2018, starts a new plan year and ended April 30th of 2019. He or she worked 1,500 hours. Again, more than the 800 needed. He or she earned an additional year of credited service. And then if we look at May 1st, again, starts a new plan year, May 1st of 2019 through April 30th of 2020. This participant works 1,700 hours, more than the 800 needed, earned an additional year of credited service. So now the member has 3 years of credited service and is in fact vested in all of the accounts, meaning that the member has 100% ownership of these accounts. And a quick footnote on this is that school hours do count towards vesting. One of the notable retirement accounts is the pension plan. The pension plan is considered a defined benefit plan, and it's paid out to you on a monthly basis when you do retire. The contribution is included in the fringe benefit package, as I mentioned, from your employer. The calculation is based upon the credited service and a yearly accrual that is set by the Board of Trustees. As I mentioned, the time does go quick. So when can you retire? Well, you can retire, if you're looking at the chart, the earliest under our plan at the age of 52 with 33 years of credited service. You can retire at 53 with 32 years of service, 54 with 31 years of service, the age of 55 with 30 years of service, and the age of 62 with 10 years of service. If you meet any of those qualifications, you would qualify for your full pension. However, you can retire at the age of 55, but if you have less than 30 years of service, you will receive a reduced portion of your pension. Some other pension features to talk about is the supplemental pension. It is possible you might qualify for a supplemental pension if you have between 25 and 30 years of credited service. Also, we offer a disability retirement if you're unable to be gainfully employed in any type of occupation and you are deemed unable to be employed by Social Security. Also, in the event that you pass away, there are death benefits that will get paid to your beneficiaries. An additional retirement account is the annuity plan. The annuity account is considered a cash balance or hybrid defined benefit plan. The annuity contribution is included in the fringe benefit package as a set dollar amount that gets allocated to your account for each hour you work. The account is credited with an interest rate, and the interest rate is based upon the average of the 30-year Treasury rate in the month of March before the plan year starts. For the May 1st, 2020 through April 2021 plan year, that rate is 1.46%. When you are eligible for a distribution, typically through retirement, your payment options are you can have it paid out to you on as monthly payments. You can also cash it out, but understand there could be tax consequences on there, or you could roll it over tax-free to another qualified retirement account. What we're looking at now is an example of an annuity statement. If you're a vested participant, these automatically get mailed out to you every August. If you think you're vested and you did not get a statement, please reach out to the retirement department and we can look into it for you. You can always check your vesting status using the member dashboard at carpenters.fund. But as you can see, there are two accounts. There's an account A, and account A is for contributions before May 1st of 2018. Account B is for contributions after May 1st of 2018. Both accounts are calculated the exact same way. The only difference is account B has a cap of 6%, where account A has no cap. So the difference being account A, there's no cap on the interest rate, and account B, there's a cap on the interest rate at 6%. The total of those two accounts is your total annuity account balance. Last but not least, another retirement vehicle that we have is the savings plan. The savings plan account is considered a defined contribution plan. The savings contribution is included in the fringe benefit package as a set dollar amount, very similar to the annuity. that gets allocated to your account for each hour that you do work. The account is considered a participant-directed investment account. What does that mean? That means that you have direct control over where the money can be invested. Now, when you are eligible for any type of distribution, typically at retirement, you have two options as far as payouts go. You can cash it out, but understand there is tax consequences on cash outs, or you can roll it over tax-free to another qualified retirement plan. After you have contributions contributed on your behalf, you will receive a welcome package and a quick start guide from the Newport Group. The Newport Group is the day-to-day record keeper of the savings plan. The quick start guide will give you highlights plus plan information on how to access your account at the Newport Group's website. You can also access the Newport Group's website via our website at carpenters.fund. You will receive a statement each quarter from the Newport Group, which will show your investment gains and losses plus your contributions based on your hours that you worked. You do have access to this account right away. However, you do not have 100% ownership until you meet the vesting requirements of the 3-year vesting that we discussed earlier. Under the savings plan, you have a total of 15 investment options to build your portfolio. It's a mix of stable value funds, bond funds, large cap, mid cap, and small cap funds. If you're savvy enough to do your own research and build your own portfolio accordingly to diversify your investments, my hat's off to you. If you're not and are overwhelmed because this isn't what you do, that's okay too. This is why if you see the bolded default funds, these are the accounts that are set it and forget it. Your money auto defaults to one of these accounts based on your date of birth and adjust accordingly as you get closer to retirement age to be more conservative with your investments. One of the features of the savings plan that the annuity and the pension plan do not have is a hardship withdrawal option. In order to qualify for the hardship withdrawal under the savings plan is you have to be vested in the plan. You have to have a balance of at least $2,000 in your account. You can get up to a maximum of 50% of your account balance up to $50,000. You're only allowed to take a hardship withdrawal once every 3 years, and you have to meet one of the 5 criteria. You can take a hardship withdrawal to purchase your primary residence, to save your primary residence from foreclosure or eviction, to pay outstanding or upcoming medical expenses, for your funeral expenses, or for post-educational expenses for you, the participant, and or your eligible dependents. If you are vested and are interested in learning more about the hardship withdrawal, you can check out carpenters.fund. That we have a whole page under the savings plan that gets into the details on the savings plan withdrawal. Just a quick closing and recap before we get into the Q&A. Just a reminder about the communication tools that are available. Also, check your hours, check your hours, check your hours. Also, if you work out of the area, understand how that works. The vesting, as I mentioned, the 3 years and the 100% ownership of the accounts. Preventative health, the vacation and direct deposit information. Make sure that your beneficiary and your up-to-date contact information is always on file with the fund office. The 90-10 plan on how that works under the medical. And the nursing program, the MD Live, the telehealth, and the HRA. And as always, if you have any questions, please contact the fund office.